Aquaba, and welcome to Expat Life Ghana. I'm Ayo, and this is Tony, and we're documenting our move from Texas to Ghana as we go beyond the return.
In this video, we're talking about getting sick in Ghana and Ghana healthcare. So let's get this video started.
All right, y'all, so about a month ago, Tony got sick.
Yep, wasn't feeling good and something wasn't right, so just thought I maybe should see a doctor.
So you made an appointment to go see a doctor at like a regular clinic.
At a local clinic here, yeah.
Right, and how did you feel about it? I mean...
I was impressed by the facility. The doctor was very personable. The staff very helpful. Everybody was generally concerned about, my needs, so that was impressive with them.
Yeah, and they seemed like they had the correct equipment, they had correct health protocols, they didn't, jeopardize your life, you didn't feel like you were getting serviced in a back alley anywhere.
Yes, very, very nice facility. Yeah.
Absolutely. But they didn't accept health insurance from the U.S. You had to pay cash up front.
Right.
And did you feel like they were a little pricey?
Maybe just a little bit.
Yeah, I felt like they were a little pricey.
Yeah.
But when you went, the doctor there kind of stated that he didn't know if he could help you the way that you needed to be helped, and that you might need to go to the hospital.
Yeah, they were a smaller facility, and I think just equipment-wise and staff-wise, they probably weren't prepared for whatever was ailing me.
So they told us to go to Korle-Bu. Korle-Bu is one of it's the largest hospital in West Africa, and one of the largest in the whole of Africa. It's a teaching hospital, and so they have multiple buildings, multiple facilities, and they sent you to Korle-Bu.
Yeah.
I feel like there is a story coming here for Korle-Bu, and I'm just...
Well, if you're familiar with, let's see, they say the county hospitals. If you're familiar with the county hospitals in America, this definitely would fit the bill for a county hospital.
Yeah, so at this point, to just give you guys a little bit of backdrop, right? Like, Tony's not feeling well. In my opinion, he probably needs a good course of antibiotics and, some kind of diagnostics to figure out exactly what's wrong. And we went to the first doctor, and the first doctor was kind of like, I'm not exactly sure. I'm going to send you to Korle-Bu because
they have specialists.
Right. They have all the specialists, and they can figure out exactly what's wrong. So we were like, okay, great. Let's head out to Korle-Bu. And we got to Korle-Bu. Like, I couldn't even find the building that they were sending us to. It's all kind of...
It's spread out.
Spread out, but not maybe laid out in a logical kind of way.
Yeah. And...
I found out later that Korle-Bu was actually opened initially in like 1923. So Korle-Bu is 100 years old, and in the 50s, somewhere about, they did some upgrades and updating, and they've done additional since then.
Absolutely.
But it definitely kind of felt like everything was a little older.
Yes, definitely outdated. Just everything just seemed old.
It just seemed kind of... Yeah, you're right, old.
Yeah.
So let's talk about the cost associated with going to Korle-Bu. First off, I should actually say, we were seen pretty quickly when we went there.
Yeah, I think having the referral from the doctor that we did to see a specific doctor that, we had a cell phone number, so we were in contact with them immediately upon getting there. That helped out a lot.
Absolutely.
And he helped facilitate the paperwork as well, getting us admitted and checked in and all that kind of stuff. It went pretty quick.
Yeah, so when you go to Korle-Bu, they do typically recommend, unless you're going for ER services, that you have a referral from another doctor. So you've seen someone else before you go. Now, this might not be universal. This is just our experience and our take from information that we gathered through the experience. So if we are wrong, pardon us. But you had to have some kind of prior visit to someone else, it seems like, in order to kind of expedite this process. Once we got there, they wanted us to go ahead and register, and the registration process had two different pay rates. There was one rate if you were
A
a
citizen.
citizen,
Yes.
and then if you were a foreigner,
Non-citizen, it was like
double.
Yeah, it went from 100 CDs to 200 CDs
Right.
for non-citizens.
Yeah, I think it was just a little bit less than 100 and like a little bit less than
It
200.
was like
but-
90, 180, something like
Yeah,
that, but it
give or
was double.
take. So that's in Ghana cedis. So 100 Ghana cedis versus 200 Ghana cedis for a non-citizen. And with today's exchange rate, 100 Ghana cedis is like what? $20?
Yeah.
A little less than $20.
Yeah. 17, 50,
Right.
18.
So we're talking about $20 to go ahead and get registered because it's a county facility or a country facility.
Government facility.
Right. We didn't actually pay anything else as far as getting treatment.
Right.
We did have to go, and it was really weird. Like, y'all, it was like such a strange experience compared to US, right?
Yes,
like
yes.
you feel like you go to the US facility and you go to the hospital and they check you in and do intake and like figure everything out.
Mm-hmm.
And then you go to a room and like things happen
Yeah.
from there. Kind of
Definitely
like
not what happened with us.
It
Let's
was-
see. After getting, I guess,
Registered? Right.
and admitted, going to the room was different.
They took you to like, it wasn't even an exam room. There was 2 desks in there, like it was 2 guys' offices, and an exam bed or a
Yeah.
nap bed. I'm not really sure which one. And like, you know, a curtain, like a Chinese
Pull
folding
curtain.
curtain. It wasn't even a pull curtain. It was like a folding curtain.
accordion
Right. And
style thing. Yeah.
before they examined you, the other guy who was at his desk left. And, you know, I was like, okay, well, maybe, like, I don't know if these are offices or exam rooms. I was in there waiting with you, and they were doing the exam. I was kind of like, oh, is this...
Yeah, it's just...
It didn't
didn't
seem...
like, privacy wasn't matter. It was like, hey, you're here, man. Everything's
cleaning
open.
people came to the door. Somebody came from a different direction,
Right.
coming out of a different door. I was like, okay, yep, it's just everything's happening here.
Mm-hmm.
And there were a lot of people waiting out in the hallway. I don't know if they were waiting for specific, like we were waiting for a specific department, if they were waiting for a different department, or for loved ones, or just waiting. I have no idea. But even through that whole process, it just felt like it didn't feel, I wasn't reassured.
It was.
I don't want to, you know, I don't want to.
Yeah, I don't want to. Yeah, we don't want to badmouth the
Right.
place, but it didn't feel like things happened in a orderly manner. It was just
It just was.
like they were winging it almost.
Yeah, that is actually a really good term. So I
Yeah.
asked the doctor that we were seeing. I kind of was like, you know, is this a good hospital? Of course, what is he going to say? No, it's terrible.
It's like,
no,
it's
but he's
great.
like, yeah,
it's a teaching
it's
hospital.
a teaching hospital. It's the best hospital around.
Mm-hmm.
The doctors that come here are coming here from the top of their class, you know, like these are the top doctors. And I kind of must have made a face or made a comment. And I was like, so like this is the best that Ghana has to offer. And he said, these are the best doctors, although we might not be working with the best equipment. And I feel like that is actually a very telling comment.
Yeah.
Like the facilities were not.
They were run down, if you just want to be frank.
Yeah, they were, and it still kind of felt like they didn't have the things that they needed,
Right.
or the things that they needed weren't fresh and updated and new.
Yeah.
So after your exam, they decided that in this office, they decided that you needed to go upstairs to have some exploratory surgery.
Right. Which
Yes.
made me nervous because they couldn't do it right away, and they were talking.
They wanted you to stay overnight.
They were talking not just overnight. You know, for 3 days. They wanted me at the hospital for 3 days, and I'm like,
So they wanted to intake you that day and have you stay overnight and get fluids so that the next day they could do the surgery, and they were thinking it would take you 2 days to recuperate before they would discharge you. That was the 3 days. So it wasn't
Right.
like 3 days intake to wait for surgery. They were going to do it the next morning, but they wanted you to like stay overnight.
yeah. for observations, I guess. Yeah.
Right. So we didn't go thinking you were going to stay overnight.
No, not at all. We were going just thinking, hey,
You're going to get checked out and leave.
Take these pills, you'll be okay, or something like that. And, totally not what happened.
Yeah, so we separate at this point. You and I separate at this point because the doctor has now written like a prescription pad, and I need to go to the pharmacy to fill the prescription, and you were going to go upstairs for intake.
And when she says to fill the prescription, she means like all the medicines, IV fluids, everything for the surgery, all of the medicines for the surgery, she had to go get.
And it was not like I just went to one pharmacy. I had to go to the pharmacy in the surgery building, and then I had to go to the pharmacy in the cardiology building. And I actually was told to go to a third pharmacy over by ER because they didn't have everything. And instead I went back to the surgery pharmacy and was like, I was told cardiology had this, but they didn't. Do you happen to have it? And they happened to have like 2 left that they were able to give me. And all of this is cash out of pocket. So when Tony says the pharmacy, I came out with two
big
gigantic bags
of medicines.
Yeah, it was like 6 IV fluid bags, the antibiotics that they were going to use.
The pain meds,
yes.
It was like, you name it, it was in there. Whatever they needed for the surgery they were planning was in this bag. All the medicines.
And all I could think as I was doing it was like, I was glad I was with you.
Mm-hmm.
But like, if somebody came in and they didn't have, how would you have gotten the prescription stuff? Like, would a nurse have gone for you?
I don't know. Yeah.
I have no idea. But
it's just so many things that we didn't know going in there, and we wouldn't have known. Had I been there by myself, I wouldn't have known what to do.
No, so I went and did all the pharmacy runs, and all of the pharmacy places were cash. So you be prepared with your cash. In total, for all of the pharmacy stops and all of the prescriptions, it was just under 400 Ghana cedis.
Mm-hmm.
So it was still less than $100 to get 2 gigantic bags of medicines.
Mm-hmm.
And so I did that as fast as I could. It took me about 20 minutes to go, maybe 25 minutes to go and walk to get all of the things and walk back up. And Corlebu is the surgery wing is multi-storied, and there is an elevator, but
it runs slow.
It's really slow. So I was taking the stairs up and down, and I'm a little slower to the 4th floor, which is really the 5th floor, which is where you were. So, while I'm getting your prescription filled, what's going on with you?
I was getting admitted to a room. Initially, they sent me to
the ward.
It was a ward, and it was just an open room. There's like beds on both sides of the wall, and that place was packed. And the lady saw my look going in there, and she was like, let's see if there's a room available. So there was, fortunately, and it was a shared room, so there was another young man in the room, and that was a little better, a little more privacy, a little more what I would have been used to.
Okay, but you say that, and when I went up and found you in the room, there's no curtain to draw between the two of you.
Right.
There was no, I didn't see a bathroom in there. So
no, there was no bathroom, so you had to leave out of your room to go to
the main,
the male bathroom area.
And then there was no entertainment. There was no...
Yeah, no TV, no nothing. So I had my earpods in.
And the bed was really short. You were kind of hanging off the edge.
Yeah.
You're a tall guy.
I'm tall here, so the beds was short. They had a fridge for, if you wanted to bring in water. There was a fridge
was there no pillow?
There was no pillow
either.
No pillow.
And the sheets were just like...
It was just one sheet
on the thing. There's no like blanket or anything to cover up with.
Right.
How are you feeling at this point?
Physically, I was not feeling the best, and mentally, I was feeling worse because I'm thinking, am I going to get the best care at this place? Is this exploratory surgery really what I need? Do I need a second opinion? Is there another option? I was thinking a whole bunch of things. But the one thing I was really thinking was, I don't want to be in this hospital overnight. there has to be another option other than this exploratory surgery.
So I come in with my 2 gigantic bags of meds, and I went to the car and grabbed, I think, like a charger and a pillow that we happen to have in the car.
Mm-hmm.
And I walk in, and I'm not gonna lie, your face was...
Let me explain. Additionally, while she was getting the medicine, they tried to put an IV in, and the first time, and this was the doctor who was putting it in, not the nurse.
The first time was the nurse, and the second time was the doctor?
No,
they were both the doctors?
The doctor did both. So the first time, I could tell he missed it, and looking for the vein, I was like, "Oh, you missed it, man." And he's still trying to find, like, no, you missed it completely.
Oh, no.
So he pulled out and he said, okay, let's try in a different place. And he tried in a different place, and I thought he had the needle in the vein, and he didn't. And there was some pain there, and I looked at my hand, and my hand started swelling up because the fluid is just going under my skin.
Now remember, at this point, you still don't feel well.
Yeah.
So you're not your normal, like, talkative, proactive self. You're kind of like, you're not yourself. Yeah, you are not yourself.
And now I got, a new pain. Like,
so I come in with the meds, and I look at you, and his face looks like, it was like pain, fear, angst. I mean, like, there was nothing good on your face.
Yeah.
And I came in here like, babe, I think my hand, and I look, and I lifted it up, and the IV fluid started running down your arm, and I was like, okay, let me go get somebody. And he's like, and it's hurting.
Yep.
So I was like, let me go get somebody. Okay, so I went out, and I went to go grab somebody. There was no urgency in their arrival.
Right.
So I grabbed somebody, I went back into your room, we were waiting. We're in there, I'm looking around, there's no privacy curtain. The guy next to you is there for, I assume, a groin injury?
Yeah. He had some pain I didn't want.
There's no AC. Was there a fan? There was a fan.
There was a fan, and actually,
a good breeze.
It was a good breeze coming through. But
it didn't feel like
the cleanest place.
It didn't feel... I don't want to put words in here because we always preach to people that you kind of have to live the Ghana life, right?
Right.
And I feel like there is a point where if you are in a place and you feel like something is not right, then you should go with your gut. We were both sitting in that place, and it was like, this is not going to work. This is not going to work. Yeah. So you looked at me and you were like, we need to leave. And you're sick, and I'm worried that I'm going to say okay, and then something's going to happen to you, like in the middle of the night, it's going to get worse, and you're going to feel terrible, or like, and then we're going to be at midnight, and we have trying to figure out where to go. So I was like, oh.
And I was like, hey, I'll just take my chances, because I just didn't feel comfortable. But when the guy missed the second time trying to get the IV in, I was like.
And the guys that were the doctors were like, top of the, these are top of their class doctors. These aren't like the C students that barely graduated. These are, y'all. So we left.
Yes.
We left. And we left, I left in fear. I mean, like, I left very worried because, we hadn't gotten anything resolved at this point. And, at this point, it was kind of like we knew you needed antibiotics. And at the very least, right? Mm-hmm. And it was like, now we're leaving, and we're not leaving with anything because it's evening time.
We're leaving in no better condition than
now
we
worse.
Came
Your hand
in.
hurts.
Now worse because my hand swelled up a little bit, right? But I think at that point I was like, okay, I was trying to go the Ghana system, to not have this Western mentality that I needed a certain level of healthcare, but for me personally, I did because it's what I was comfortable with.
It didn't, and the whole process didn't seem at all preventative or diagnostic. It seemed very reactive. Like, something's wrong with you. Let's cut you open and see what's going on. And I'm like,
I didn't like that.
No, my dad's a chiropractor. He's like, the last thing you do is let someone cut you. There's like 100 other things to do before anybody cuts you open, unless it's like you've been in a car accident and we have to. But otherwise, So
Yeah.
I was worried about them cutting you open.
Yeah.
And then the doctor says some crazy stuff like, there's like a 90% chance that after we do this, everything will be fine, but there's a slight chance that he could have this disability for the rest of his life. Like, wait,
And I was
what?
like, wait, hold on.
As
man.
an afterthought, he said that.
Yeah, I was like, yeah, you
I was like, well,
you could be messed up for life after this. Who knows?
What? No. And I think after I heard that, and then the face, because this was like, so we left.
Yeah.
We left. Before we stopped
time,
talking, it was like 9 o'clock at night.
Yeah,
it was
in the
late.
evening, yeah.
Because I had to drive back.
Mm-hmm.
So, before we leave Corlebu, I do want to say that they're a teaching hospital. This is just our experience. We are not trying to talk badly about the facility. We're just stating how we felt about it. And I also want to let you guys know, I mean, for all in, we left less than 500 CDs on the table there, which is less than $100 US.
Yeah.
But they do have facility there, ER, they have cardiology, they have internal medicine, pediatrics, they have radiology. They're one of the few facilities in West Africa that has burn units, and they have the heart center. They also have a dental unit. So they have, I mean, like, the number of facilities there are so encompassing. I hope I hit all of the subspecialties: dermatology, renal, ENT, oncology, ophthalmology, orthopedics.
They got it all.
They have pharmacy where they mix their own stuff.
Yeah.
So yeah, like they have everything. We really tried. So we left, and we left with the understanding that the next morning we were going to see if we could get a second opinion somewhere. Mm-hmm. And if the second opinion agreed, then we were going to go back to Corlebu and just
go with the surgery. That's what the second opinion
said to do.
Yeah.
So the next morning, we got up and we called to Luca Health. Mm-hmm. And Luca said, we kind of explained, like, there's pain, we're ill, is there any way you can get us in? And they were like, yeah,
come on right on in.
Come on. So we went over. Mm-hmm. We actually they have two facilities that are in the East Legon area, just outside of Greater Accra. We actually went to the wrong one first. Mm-hmm. So it afforded us the ability to see both places.
To see both places. And even the guy who came out, the nurse who came out to tell us, hey, you're in the wrong place. Hold on a second. I was like, oh, no, we can find it. And he was insistent that we waited, and hey, I'll get you to the right place. Just hold on a second.
And the person who talked to us was just like, hi, how are you today? We're glad that you're here. It was just like it was like the feeling was completely different for you.
I think we found the place for us.
Yes. So we went to the wrong facility. They redirected us to the correct one, and we went to the correct one, which was really nice. Like new, everything was fresh and felt modern. Mm-hmm. And there were a couple different things going on in there. They were doing diagnostic testing. They were doing patients. There's a surgery department. So when we got there, it felt like it was really busy. And I was like, oh my God, we're going to wait forever. But when we got up to the office,
it was, we didn't wait much longer at all. Yeah.
Right. So it was pretty easy. Now, between the two facilities, they do ear, nose, and throat. Mm-hmm. They do general surgery. They have internal medicine. I want to make sure I say all the things, so I have to look down. They have gynecology. They have urology and nephrology. So those are the specialties that they're working in right now. And we were actually supposed to go and do a interview there after they finished their new surgery wing. But with Tony getting sick and something, my dad has passed, so it was like we just kind of got sidetracked and never got back over there. But that is actually how we knew to even look for Luca Health, because we were actually intending to do an interview there. Mm-hmm. So they have all these specialties.
Let me just mention, we still plan on doing the interview there. We'll be back there.
We will be back. So we get there. How did you feel when we got there?
Oh, I was at ease, because it just seemed like things were clicking there with my concerns. I think we were on the same level and same page as far as what I thought I needed and what
they thought you needed.
They thought I needed, yeah.
So when we told them that you were at Corlebu and you were going to have surgery.
Yeah, they looked like, oh, wow.
And not in a negative way, but just like, surgery. Like, maybe we can do some tests first to see if we can figure out what exactly is wrong.
Right.
And to which we're both like, yes, let's do that.
Test first.
Let's do that. So we went, and the cost of the visit, I had to go. I couldn't remember how much they charged in Ghana cedis, so I had to go look at my credit card because they do accept point of sale, so they do accept MasterCard and Visa. And the charge on my card was like $68, which would be about 400 Ghana cedis. Mm-hmm. So, given at Corlebu, between the pharmacy and the intake, it was actually less than what I had paid over there. So I was like, okay, that's cool. 400 Ghana cedis, please take it happily. The room was...
It was really nice. State of the art. I mean, everything was new. And that's not why I liked it. It was just the feel that I got. I felt relaxed there.
The staff made you feel like that.
Yeah,
right?
yeah. And just the comparisons. I felt on edge at Corlebu, where it was a more relaxed and calming atmosphere at Lucid Health. So that mentally is what I needed. That I'm scared because I'm not feeling well. Something's not right, and if I go into a place that it's sketchy or looks sketchy, I'm not mentally going to feel better from what physically is ailing me, because I'm like, hey, I don't know if I'm going to get the best here. And so just being in a place that physically was welcoming kind of put me at ease mentally, and that was good.
And from the wife point of view, seeing that the facility it's not necessarily that it was like newer, but it was very well kept. Like there wasn't, even if two places had been in identical facilities, it definitely felt like Luca was maintaining the environment in a different kind of way.
Yes.
So that's to speak to that. We got to the room. The room had privacy, and it felt like they had all of the equipment that would be appropriate in an examination room. The doctor came in. He said, let's get you on antibiotics, which is what kind of we already felt like that was going to be a given. And let's do some tests.
Right.
Yes.
Yes, tests.
Tests would be good.
Yeah, no exploratory surgery. That was...
And we asked about that too, like, are you going to need surgery? And he said, well, I can't tell you yet because we haven't gotten the results of the tests. And that to me was like, yes, that's actually how it should work.
Yeah.
So
that made me feel a lot better, knowing, hey, I'm not about to go under the knife. Something I've never... Well, I've had a couple knee surgeries, but nothing
like this.
Yeah,
no.
Yeah, nothing like this. So.
And you wouldn't have a chance of being permanently,
yeah.
like that. All right, so there's that too. So they did send you to diagnostics to have a test done, which was just about 100 Ghana cedis. And actually, at Corlebu, they sent you for blood work as well, too. I didn't even include that as the price.
Right,
we did go there and pay. I think
did.
it was like 80 Ghana cedis to have your blood work done.
Mm-hmm. No, it was 90.
It was 90?
Yeah, because it was outside.
We had to walk down the way. Like, you're sick, and we're walking 3 buildings down to go get your blood work done.
Yeah.
So anyway, you did have a diagnostic done in both places, up roughly the same price. So, it was maybe 20 cedis more to do this set of diagnostics versus a set of blood work.
Yeah.
And with that said, like, that was the other thing that really struck me, was that for an expat coming through, right, the price difference is not so significant that you would be, like, you would have to be like, I can't go to Luca. It's just like,
it's when you look at the facility, you think, oh, this is going to be expensive.
Right.
Oh, man, this is going to cost an arm and a leg. But really,
that's what we thought.
The price point, I mean, by comparison, they were right on. I mean,
yeah,
I didn't really see much of a difference in the price point.
Right. So, I mean, from this experience, the service and procedures or things that we went through at Luca were the almost exact same price as everything we went through at Corlebu. And you were able to get your prescriptions, go get those filled, and started feeling better like the next day.
Next day, yeah.
And you had not been feeling well for over a week. I mean, like, it had been a week or
Yeah, it had been a little over a week, 2 weeks. Yeah.
So that to get that to get that alleviation right away from what they were able to do was pretty satisfying.
So
as
that
well.
was with no exploratory surgery.
That was a big deal.
That was scary. I tell you that.
Well, Luca is only open Monday through Friday, like 8 to 5, kind of regular business hours.
Mm-hmm.
So, it's not something that you can do if you have an emergency on the weekend or, run over. But Corlebu does have emergency services, and they're kind of just open all the time. So definitely, you're going to get needs met in 2 different kinds of ways at these 2 places.
Yeah.
But it was interesting now for us because now we've gone through this experience. We've seen a
private
Right.
health facility, and then a major
country hospital, public.
national
Right.
health facility, and then a smaller
private.
another health facility
Right.
with state of the art everything.
Yeah, I was talking to one of the physician assistants while you were getting your testing done, and he was saying that he worked at in Houston at the cancer center at MD Anderson, and I was like, oh, yeah, that like.
You worked at MD Anderson.
I just,
I would love to come and see you, because I know the reputation of MD Anderson. So if he worked there,
I
he's
believe
good.
he said MD Anderson, but it was just like in the conversations that we had with the doctor and the physician's assistants and the assistant at the front desk, like the secretary and the nurses, everybody there seemed like they had just a crap ton of qualifications.
Yes. And I had to go for a follow-up visit to Luca Health, and I called and I said, I need a follow-up visit. The doctor told me, call, for follow-up. She goes, yeah, okay, we can see you Tuesday at 5 or Tuesday at 4 or something like that, or whatever the time was. She says, okay, and she said something else to me about the price, or I don't know what she said to me. I'm like, yeah, okay, no problem. She says, okay, we'll see you then. I'm like, wait, I didn't tell you who I am. She says, no, we know who you are, Mr. Jones. I'm like, whoa, okay. I don't know what that was about. If it was okay, we only got one patient in here with the American accent, or I don't know what that was, but that
You
made
liked
me.
that,
I
though.
did like that. They knew exactly who I was calling, and that means a lot to me. That I wasn't just a number or just a face, just another person in line. That they took the time to know who I was and why I was calling. That was important.
And I think to kind of like quantify all of this, like I felt like all of the doctors along the way wanted the best for you.
Right.
But it definitely felt like the private care doctor couldn't service your needs because of the complexity.
Right.
The public health doctor, so the public hospital doctor, like even while he was doing intake on you, he fielded 3 more surgery calls on his phone. So it was like he'd be talking to you, be like, hold on a second, I hear that they're here. Okay, so go ahead and prep them with IV. You're like,
yeah, it was like
they were just.
I may have been important, but he was looking at 3 other issues of major importance,
right? Like
that
you were one
he
of
had
5.
to deal with after this conversation he was having with me. So I didn't really feel like that personable attention I was going to get.
And it just felt like they had a lot going on, and they had a lot of demands, and they were working without all of the things that they needed to be successful. Not necessarily that they didn't know, but like they're just working under a different set of constraints. And that might also be why I was like, well, let's just get into surgery and figure out what's going on so we can skip the step of diagnostic and just fix the problem and get going and come back out. And the private place, it definitely didn't, like Luca didn't feel like that at all. It definitely felt like a knowledgeable staff, thoughtful, calm environment where they're clearly able to meet your needs, and they've prepped the facility to do so in a calm and controlled manner.
Yeah.
And I think that you felt that. I felt it.
Yeah,
Like,
yeah, absolutely.
As
absolutely.
the nervous wife next to him, I was like, okay, let's be calm and grab all your stuff. We're running out now.
And as a side note, I am not the guy who willingly wants to go to the doctor. So if I'm sick, I'm like, not going to tell you until like I'm almost dead. Like, I think I'm dying and we need to go to the hospital.
That is correct, y'all.
So going to a place that makes me feel comfortable and like, hey, this wasn't too bad of an experience will
That's huge.
more than likely make me want to go back and say, hey,
Yeah.
okay, I think something's wrong. Let me not let this be an issue. Let me take care of it
Yes.
now. So I definitely felt good about going to Luca Health.
Yeah, and they definitely felt preventative versus I think at Corley
Yeah.
it felt very reactive. And the doctor at the private care still felt like he was, you know, very caring
Yeah,
and
I
able
think he was like in the middle of the
Yeah,
two of
maybe,
those.
yeah.
You know, like if Corley Blue's here and Luca Health is here, he was definitely in the middle.
Right.
Maybe he didn't have all the resources, but he was his staff and
That was really nice.
he was very attentive. So I appreciated that.
All right, so what recommendation do we have for folks who get sick in Ghana?
That depends on how sick you are, and what ailments you may have.
I'm not even going to say that. Like, if you can, and you're able, and you're in the right proximity, Luca Health was like a great experience.
Yes, definitely a good
If you are in an
top-notch
emergency, yeah,
experience
Like-
for healthcare.
I can't find anything to complain about.
No.
If you are needing urgent care after hours, Corley Boo has
Corley
knowledgeable
Boo,
doctors. But you are going to need to be more proactive and
Good word.
inquisitive
Yeah.
about what care is being provided to you.
And options. That's the thing. I didn't feel like we had options at Corley Blue. It was just, hey, we have to do this. I was like, wow, you know, nothing else we can do. Just that, okay. But
You're totally right. It is the options. They never gave an option. They
Yeah.
were like, the only thing you can do is surgery. Let's go do this. Whereas at Luca, they were like,
oh, surgery? No. Let's test first.
Yeah.
Let's see what really is going on before we start talking about surgery. So
and even at that point, he was like, you know, it could be this outcome, it could be this outcome, and you've got a couple choices at either one of these places. But all of it still felt like you
we
were
had
still,
options.
yes.
Yeah, we had options.
So
Yeah.
options, you're totally
yeah,
right.
Yeah, there was no option given. Listen, you're getting admitted tonight. Tomorrow we're having surgery.
There was like a straight jailbreak trying to get you out of there too.
Yeah, I
They're
was
like,
like-
wait, you're leaving? We're like, yeah, he with the kids.
Gotta go. Car's running.
Oh my god.
Yeah.
Yeah. So that's our take on healthcare in Ghana.
In Ghana, we got to experience a little bit of the best, a little bit of the not best, and something in between. So,
Yeah. All right, so if you haven't already subscribed, please do. We are going to go back to Luca Health and take a tour of their facilities, so we'll be able to give you a little bit more information about them specifically. And other than that, we will see you in the next one.
Charlie out for now.
Okay, so as a total aside, did I tell you the story about being in the elevator?
No, what happened?
I was bringing up your prescription, and I got in the elevator, and I thought it was going up, and it went down, right? So I go down, and I'm wearing my mask and everything, but the door's open. It's a guy in a white hazmat suit with
Oh,
like the
wow.
whole thing, and I looked, and I was like, is he gonna
Ooh,
come
I'm
in
get
here?
on the next one.
No!
Get outta
And
here.
he did. He totally came in, and he's got this like bucket of whatever, like a big barrel, and I'm like in the back corner thinking, should I just get off and walk? And so he pressed the button and we went up 2 floors, and I thought he was gonna get out, and he didn't. He just put the bucket out the door, and he stayed in, and I was like, okay, I gotta get out of this. Yeah. So I may or may
Wow.
not have whatever the guy in the infectious suit.
Oh, thank you. Yeah. Now I got it.
We all have it. It'll be fine.